Okay, so let's see. Okay, so let's talk about the cervix, and yeah, let's talk about the cervix. So let's begin. I'm a herbalist. A lot of people didn't really know what a herbalist is or what a herbalist does. So basically, what I do is I support people in their health with plants, and that's pretty much it. Maybe a little dietary recommendation, the odd supplement, but pretty much plants and whole plant medicine I use. Um, a little bit. This video's this talk is a little bit different than the kind I often do. Um, or it's not that different. What I do is I just wait just a second. I'm just trying to figure out what did I do. Okay. Um, when about I started herb school about 20 years ago. I did a 4-year program. It was a very biomedical model of herbal medicine. And then I started practicing. And over that time period, I've kind of like taken a lot of traditional herbal medicine and the biomedical model of herbal medicine and merge them. And I'm finding now the more I practice, the longer I practice, is my understanding is that the body does a lot of the healing, that it's not necessarily the plants that are doing the healing, but it's more like a relationship between the plants, the microbiome of the body, and the body mind complex. I know it's calling our our beingness a body mind complex is a little kind of dry and not too, it doesn't sound nice, a body mind complex, but it really is. Our bodies and minds are completely woven together and can't really separate them out, and plants don't separate out the body mind. So I just call it a body mind complex. So when I'm talking about the body mind complex, in many ways I'm talking about the human being and the livingness of the human being. And this is the plants are interacting with, there's that triangle. There's the biome, there's the body mind, and then there's the plant. And this is an intelligence that they work together as a singular intelligence. Okay, so that's like a huge, big picture kind of plant medicine view. And so, talking about the cervix, I'm going to be approaching it to a certain extent from a biomedical model because that's what people come through when they end up at the herbalist, is they've gone through a biomedical model where there's been often some kind of diagnosis, some kind of a concern has been presented, and then treatment is offered, or it, mostly no treatment is offered. And so then how, as a herbalist, we would look at that situation. So that's what we're going to talk about tonight. And so, yeah, so I welcome for, great to see you, Sue. Okay, so let's see here. Where are we? Okay, so we're going to talk about the cervix. So this is the cervix here. So why talk about the cervix? Why do this conversation? Well, according to the Canadian Cancer Society, 1,550 women were diagnosed with cervical cancer in 2023, and approximately 400 will die from it. Cervical cancer is a cancer that takes a long time to develop. Most cancers develop over years. Most cancers are quite silent until they're well advanced. And when I say silence, they're not presenting with any symptom picture. People always think cancer is really painful, but not until it's pressing on a nerve. Those tumors are interacting with the nerve. Do they become painful? So cervical cancer is pretty silent. There are symptoms of it. One is if someone has a chronic ache in the pelvic region that doesn't seem to resolve easily, I'm always concerned, and I send them for examination because that's a problem. But often what happens with cervical cancer is for a number of years, there's what's called cervical dysplasia. And that's what I usually see in practice is cervical dysplasia. I do support women who have a diagnosis of cervical cancer as well, but cervical dysplasia I see. This is a crazy statistic. Between 250,000 to 1 million women in the US will be diagnosed per year. Now, I don't know if that's just really bad record keeping or if it's why that number is so, like, the differentiation between those two numbers are so huge, but it should be a much clearer. So what are we talking about here with this diagnosis? I question that. And it's young women, mostly between 25 and 35, women in the height of their fertility period. So this is a big deal. And treatments for that, why I want to talk about it is treatments for cervical dysplasia are either wait and see what happens. Women are often told, come back in 6 months or come back in a year, and we'll just keep our eye on it. That's stress inducing because in the media, there is a lot of talk about cervical cancer. A lot of women know people who have had cervical cancer. And then there's also this HPV vaccination that girls are being offered at age of 12. And that's brought cervical cancer into the mainstream awareness. So, like, I don't know if wait and see is an appropriate response for a lot of women. They feel not well supported with that response. And then if there is, if they go back a number of times, the doctor will eventually recommend a fairly invasive procedure that can either leave scarring on the cervix, which will prevent its ability to dilate, which means that either it's not going to let sperm in or it's not going to let it's not going to dilate during labor, or it can, the scarring can also reduce a woman's ability to orgasm. And it's so funny because when I was doing research for this talk, nowhere did it say that a scarring on the cervix can reduce a woman's ability to orgasm or her sense of sexual pleasure. And that's an issue for women when they lose the pleasure of sex, and as it should be. So this is something that I just want to bring to the forefront. Okay, so let's talk about what can herbal medicine do here. Well, the first thing is if there are abnormal cells on the cervix, it's really up to the body to take care of that. That's the body's job. That's the immune system's job. The immune system has two essential jobs. One is to help support the biome and the biome balance in the body, our microbiome. That's one job, and the other job is to eliminate rogue cells. So if there is dysplasia on the cervix, that means the immune system has not got that for some reason, or that there's a microbiome imbalance. The second thing we can do as herbalists is we can support the resolution of an inflammatory response occurring in the cervix and the vagina. And that's really important because the inflammatory response is often discussed these days as a disease process where in my mind, I see it as a healing process. And if it can't be brought to resolution, then there is no healing. So if there's an inflammatory response, it's because there's something happening that is asking the immune system attention, and abnormal cells would definitely be asking for the immune system's attention. Support the health of the cervical mucosa. We'll talk more about this. And then also support the health of the microbiome in the vagina, cervix, and uterus. Okay, so these are ways we can approach cervical health. Okay, do you have any questions so far? I kind of get on a roll. So if I'm on a roll and you want to like ask a question, like don't worry, interrupt me, because it really helps me make sure that you're receiving what you need. And that's the purpose of this webinar, is that you receive what you need, not that I say what I have to say. Okay, so that I just really want you to know you can do that. Let me see. Hi, Allie. Okay, so let's go back to our little chat, our screen. Okay, here's calendula. Calendula's the big healer in this situation. Okay, so let's just do a little anatomy and physiology so that we all know what the cervix is doing and what the cervix is. So this is essentially your cervix. Cervix means neck in Latin. It's basically here, this is uterine material. This is all uterine tissue here. And this is basically, you know, the cervix isn't as intensely uterine as the uterus, but it's basically an extension of the uterus. And then here, it meets vaginal tissue. So this is the opening here. And this whole area is the cervix, this narrow pathway. But this area here is the piece that we're really going to talk about. It's very muscular. We're going to talk about that muscle. It also has a mucosa, so it has a mucous membrane. And the mucous membrane of the cervix feels very much like the mucous membrane in the side of your mouth. So if you touch the side of your mouth with your tongue, that's what the cervical mucous membrane feels like. It's a crazy, I find like anatomy, I'm kind of an anatomy physiology geek, so you'll have to bear with me. So I just wanted to show a couple of different kinds of viewpoints of the cervix. So here's the cervix, the frontal. This whole area is considered the cervix. This is the area we're going to be talking about the most. This is the cervix over here. This area here. Again, here's the area we're going to be talking about. It's called the transitional zone or the transformation zone. Here's your bladder, colon, spine, uterus, fallopian tube, and then here's a really big close-up. This is the area we're going to be looking at mostly, and this is the cervix. Just to give you a sense of the location of the cervix in your body in relationship to your other reproductive organs. Okay, so I'm going to have to get rid of your guys' picture because I can't see what I'm doing. Okay, so there's two areas of the cervix. This is the inner area. It's called an endocervix, this area. And this extocervix, which is this area. This area is more associated with vaginal tissue. Obviously, it's in direct relationship with the vagina, and this area is more in relationship to the uterus tissue in the uterine, or the endometrium to be more precise. And the endometrium is the outer layer of the uterus that we shed every month. Okay. Now, there's different cells, different types of cells, and this is a little bit deeper anatomy physiology than I usually go into, but this is an important piece to understand why the cervix is such a vulnerable area in the body. So there's different kinds of cells. So simple columnar epithelial cells. These are the cells that basically line the tubes of your body. So these cells you'll find in your alimentary canal. So that's your esophagus, your stomach, your small intestine, your low intestine. Some of them have no little hairs, and some of them do, like the cells that simple columnar that are lining your respiratory tract, or in maybe like even the small intestine. And the little hairs are really important because they move mucus along. So in your respiratory tract, the little hairs will move the mucus up and out of your body. And then in the small intestine, these little hairs, like I think of them like uh, taste buds. Like they're tasting everything that's coming into the small intestine and deciding how is this best to absorb and where is it best to absorb in terms of your nutrients. So these cells, these ones are here, okay? And they also are called glandular cells because they release mucus. So when we talk about cervical mucus during ovulation, everybody know about cervical mucus and ovulation. Everybody's done that study of when you're ovulating and are not relying on an app. I hope so, hope so, hope so. Anyways, so that these are the cells that are releasing the cervical mucus. Okay. Okay, now let's go back to our picture. This is a little tricky, so if you're lost, tell me, okay? Okay, so along here, along this bottom in the ecto cervix is more another kind of squamish cell, but these are the squamish cells that are like your skin, the surface of your skin, and the surface of your skin is tough. Like it's those that those cells are really tight. They have like this stratified layer where, you know, it's hard for things to get in. It's hard to rip those cells. Super important, right? Because we don't want to have a really fragile skin. So this is what we're finding in this part of the cervix. And this is basically similar to the lining of the uterus, okay? So these cells replicate very quickly. They replace themselves very frequently. And these would be the stem cells that feed this layer of cells. And as these cells divide up, they change shape until they're fairly flat. And the nucleus also changes to be something that's very small and not as active as up here where they have to divide and divide and divide. These are fast dividing cells, okay? And they replace themselves quickly. These cells also, like there can be shed and then replace themselves very quickly. So we've got two types of cells that replicate very quickly. That is important, okay, to remember. So just to sum up, there's two types of cells in the cervix, okay? And these cells trade places a little bit depending on where you are. So a girl has the columnar cells never come outside of the cervix. I don't even know if they're developed, right? As we, as a female body hits puberty, those columnar cells start growing, the cervix changes, and then as we begin to ovulate, those columnar cells come out to release all that mucus. The mucus is a big part of fertility, and we're going to talk about the mucus. And then when we're no longer fertile, post ovulation, those cells go back in and that squamish cell comes back into play. So there's this shifting always going on here, and it's called the transitional zone where that shift is happening. And that's where the cervix gets in trouble. Okay, that's why it's important to understand these are quickly dividing cells that the different kinds of cells move in and out. Okay. And that's why it gets in, that's one of the reasons it gets in trouble. So the cervix has all sorts of different faces. So here it is in pregnancy, very tight, very closed, lots of mucus. Here's menstruation. Now notice how the opening of the cervix is quite different during menstruation than during ovulation. And here's what a pap smear looks like. Here we have another image where the cervix is very closed here. It's not at all open. And then here we have it open for ovulation. And again, you know, the classic feeling of the cervix is when we're ovulating, the cervix feels like lips. When it's closed and we're not fertile, it feels like a nose. The tip of your nose. It's hard. Okay, so what is changing? So here we are, the transitional zone. So this is the transitional zone. And this is an image of the squamish cells, the cells that are like your skin, meeting the cells, the columnar cells that are like your mucous membranes. Okay, this is the meeting. Okay. So this is another image. So this is definitely, this is always columnar cells. This is always your squamish cells, like your skin cells. And then this is where they transition depending on where someone is in their cycle. Menopause, the cervix has a different kind of feel. This is mostly squamish cell during like your skin, menopause, postmenopause, once one is finished ovulation. And then also pre-puberty, this is all squamish cell. Everything's closed. Here's another image. This is kind of a weird image. This is I chose this image because there's actually like within the vagina, within the cervix, there is like a villi, and villi are like little kind of finger movements that move out. It's not the greatest image, but just to give a sense. And then here's the epithelial, and these cells come down like this, and then they go back up. And here again, this would be like the transition zone. Here's the opening, the doorway into the uterus, essentially. And then this would be the transition zone, very small area. Here we have it again. This would be the squamish cells. See how they're nice and flat, like the skin. And here's the basement membrane and the cells dividing up until they're nice and flat. And here's the columnar cells. And you can see how it's more like a villi, rich in blood supply. And this is one of the ways the uterus enhances its blood supply, by being kind of like a folded tissue. Okay. Any questions? I see Marielle is thinking. Okay, so let's keep going if there's no questions. Or are you just baffled and you don't know what to ask? Please tell me you're not baffled. Okay. 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 So this is the area here that has challenges, right? Where there's that opening, that tender gateway. And, you know, I always think that, you know, when we're in transition is when we're most vulnerable, usually. So here's one more image of the cervix, the vagina, and then this transition zone. Okay, so what does the cervix do besides provide a doorway into the uterus? Okay, so the cervix creates all this mucosa, and the mucosa blocks pathogens. That's one of its jobs. Like, it's thick, and it is, you know, we talk about this weird word discharge, but what we're doing is any unwanted bugs coming into our respiratory tract hopefully is caught in that mucus and and washed away, just as the mucus in our respiratory tracts do that. A runny nose is washing out germs, washing out microbes that aren't helpful to our wellness. That's one of the things it does. Um, it's amazing. Yeah, I find mucus just amazing. Okay, it obviously facilitates the passage into the uterine cavity, and that's like sperm, and it allows menstrual fluid to leave. It's about sexual pleasure, and it's such a powerful muscle that it can keep a baby in place. My mom had a 12-pound baby, and that cervix, her cervix, like her powerhouse cervix, kept that baby in place for 2 extra weeks. Can you imagine? So, like, her bladder's never been the same. But you just think about like your bladder, and you know when you have to pee and you're going, oh my God, I gotta pee, and you're squeezing and you're holding, and like it's just a little bit of pee. Like the comparing a muscle that can keep a 12-pound baby in place and a muscle that can keep pee in place, like you can't even consider the strength of that muscle in the cervix, like crazy. Okay, so it holds things in place, and it lets things in and it lets things out, and then it has this fluid that keeps things out that we don't want there. And then it's sexual pleasure. Stimulation of the cervix creates sexual pleasure, and it's interesting that just one thing about the cervix and sexual pleasure is that it's it needs to be woken up, the sexual pleasure. So a lot of foreplay supports orgasm with the cervix, okay, as opposed to the clitoris. And this is just another like amazing, like here's a chart of how the cervix dilates to 10 centimeters. It's extraordinary. Okay, the cervix is sensitive. It is a very sensitive place in our bodies. And you know, I personally feel like we should reclaim the word sensitive. Um, you know, it's not unusual when I'm sitting with someone, they'll go, well, I'm sensitive, kind of apologizing for being sensitive. And I'm like, well, I'd rather you be sensitive than insensitive. And so we need more sensitivity in our world. So when I say the cervix is a sensitive place, I mean, it's a sensitive place. In a good way, okay? So it's sensitive, it's reading stuff, it's knowing like what are we going to let into our uterus? Like we don't want that, okay? It knows it's a good boundary, and good boundaries are sensitive. Okay, sorry, sort of my um thing. Okay, so here's the cervix. Okay. So pH, this is a yeast infection. So the pH of the vagina is really important, and the cervix is quite sensitive to this. And basically, our vagina doesn't like a lot of different types of bacteria, viruses. It just doesn't like it. It's open to the world. It gets things put inside it. So it's a fairly harsh environment, and that acidic environment of our vagina is part of the vagina's immune system. One of the things about the vagina is a lot of the bacteria, the microbiome that lives in a healthy vagina is lactobacillus species. And lactobacillus creates an acidic environment. Lactobacillus is basically yogurt. That's the bacteria in yogurt. So you can really enrich your microbiome of the vagina with just a little bit of yogurt. Like not like your blueberry astro yogurt, right? Like you don't want that unless you're having some fun or something like that. I don't know. But you want a good quality yogurt, right? Something with like a layer that comes on it, or you make your own yogurt, right? It's a really nice way to rebalance the microbiome of the uterus. And remember that it is the microbiome that is probably managing most of the bugs that are coming into the uterus. So any bacteria, parasites, or viruses coming in, the microbiome doesn't like them and will help eliminate them. Okay. So it's very sensitive to pH balance. It likes an acidic environment. Yeah, just a few things. I've seen so many yeast infections. So yogurt, a good quality yogurt's really great. Garlic tampon, insert it at night. Sleep with a little bit of garlic inside the uterus. So here there's a threading of the garlic, and then you insert the garlic in. Often, I'll also suggest that women wrap the garlic in a little bit of cheesecloth and tie a string around the cheesecloth, dip the cheesecloth in some olive oil or sunflower oil, whatever you have to lubricate it, and then put it in that way. It kind of protects the sensitive tissue from the volatile oils inside the garlic, which can be also irritating to the vagina. Often if the yeast infection is a little bit out of control, the garlic works really well at night, and then you take the garlic out, and then you put the yogurt. You can just put a little yogurt in your vagina, use your finger, just put it on. You can bath in apple cider vinegar. You can do sit baths with some apple cider vinegars, and you can use herbal teas. I've used herbal teas quite successfully for really uh, yeast infections that just are brutal. My favorite is chaparral, but I don't always have it available since that's sort of a southern southwest herb. Thyme works really well. Some people use essential oils in the bath. There's different things you can do, but also this is an observation, and doesn't hold true all the time. But I have seen a number of women have reoccurring yeast infections when they have a sexual partner that they're ambivalent about. And relationships change. And if the relationship changes and the ambivalence disappears, often the yeast infection will disappear, or they get a new partner and the yeast infection disappears. I don't know why that is, but I always just say, the cervix is sensitive, or the vagina knows. So if you do, look at your partnership, and if you do have chronic yeast infections, look at your partnership and like what's working for you and what's not. And again, it's not all the time, but I have seen that more than once. Sperm, bit of a problem. It's very alkaline, and it disrupts the pH balance of the vagina. And sperm also has a lot of prostaglandins in it, which soften the cervix, which is part of its job, soften the cervix so it can get inside the uterus. That's its job. Cervical mucus, though, is a big filter. Like if the swimmers aren't swimming well, or if they're not viable, they get stuck in the cervical mucus, can't get through it, and they get flushed out. So a lot of ejaculate doesn't even make it past the cervical mucus. It's like the cervical mucus is like, this is the boundary. Are you good enough? No, gone. Okay. There's this whole sometimes, with women's health, you can tell I get stressed with this stuff. I'm scrubbing my head. Yeah, so sometimes with women's health, it's been filtered through the male lens for centuries. And it's really important to keep that in mind. So there's this whole thing that if the sperm's deposited right by the cervix, it doesn't have a chance to change the pH balance of the vagina, and it just goes straight into the cervix. But, I just think, oh, I don't know, like, I just don't know. Like having had enough sex in my life to know that like once the sperm's in your vagina, it's in your vagina. It doesn't just go straight into the cervix, like, so, but if you don't have a vagina, you don't really know that, right? So just like look at the lens sometimes that medicine's coming through. So hormones really have a profound effect on the vagina. Obviously, estrogen, which prepares the body for ovulation, it increases cervical mucus with estrogen as we approach ovulation. And it changes, estrogen is the trigger to change that transition zone where the cervix opens. That is estrogen that's changing that. Progesterone, on the other hand, strengthens the cervix. It closes up the cervix. It really causes, and if there's a prolonged period of release of progesterone, as there is in pregnancy, progesterone actually changes all the collagen within the cervix, and the collagen is like the material that how do we describe collagen? It's like the net that everything's sticking to, like our bones. There's this net that the calcium sticks to. That's all collagen, right? And it strengthens the collagen, makes it really strong, so that my mom was able to keep a 12-pound baby in there, right? So progesterone has a profound effect, and then also uh, uh, prostaglandin, which is sometimes called a hormone, sometimes it's called a cytokine. It softens the cervix. So black cohosh is a great plant for softening the cervix. So, and some people suggest that it's the prostaglandin effect with black cohosh that is both the abortifacient effect as well as supports the labor during labor, helps initiate labor. But really it's oxytocin that causes the cervix to dilate. So it's all tied into our hormones too. So the takeaway, transition zone of the cervix is the most vulnerable area due to rapid and frequent cellular changes. The microbiome of the vagina is protects the health of the cervix, because if there's an infection, like say there's a yeast infection, that's inflammation. There's an underlying inflammatory response. That's the burning, that's the itching, that's the pain, that's the discomfort, is the inflammatory response. And an inflammatory response is like, oh, this microbiome's imbalanced, we got to do something, and it's trying to clean up that imbalance. So the microbiome balance is really important. Chronic inflammation. Okay, sorry, I'm gonna just stop the screen share again. I'm kind of all over here in a moment. Okay, so chronic inflammation is problematic because it can cause cellular damage in terms of disrupting DNA processes. As a herbalist, I'm not a cancer specialist. I do work with cancer. I have had many clients that I work with cancer, but I don't see myself as a cancer specialist in herbalism. One of my mentors and friends, Chantal Cabrera, she's a specialist in cancer and herbal medicine. And she talks about how a chronic, that cancer is actually a chronic inflammatory disease. And so when there is a chronic inflammation in the vagina and the cervix, it's more likely there's going to be dysplasia because the damage to the nuclei and the DNA in the cells, there's more probability of that. Okay. So you want to get that biome imbalance. The relationship to sperm, The hormone imbalance is really important. And any signs of inflammation is a sign of infection or tissue damage. Okay. So sexually transmitted infections. Now, these are the nasties. These are the guys. I shouldn't masculate them. These are the microbes that are causing problems for your cervix and for the rest of your reproductive tract. So human papillomavirus, HPV, is the one that is most commonly associated with cervical cancer, okay? And it's non-tender. There's no discharge, there's no burn, there's no itching. You basically don't know it. Although there is a little bump, often there's little bumps around the vagina. So actually today I was talking to a client who we've been working on her cervix for about 4 or 5 months now. And she's had cervical dysplasia now for, I don't know, 4 or 5 years, something like that. And the doctors was really pushing her for procedures, and she just doesn't want to do it, right? So we've been working on it. And one of the things she had was this little bump right up by her cervix, and it's gone. So we were kind of like, good job. We'll see what happens with her next pap smear. Her doctor is not happy. Okay, herpes simplex, it can, anywhere around your genitalia. It will pop up, itchy, burn. It's fairly localized, little pustules. They come and go. Really very stress-induced. So let's just keep that word stress-induced in the back of our minds, because we're going to talk about that in a minute. Gonorrhea, really serious condition. There's vaginal tenderness. There's discharge, often with an odor. There's burning, there's bleeding. So we've got like some serious inflammation going on. And that is go to the doctor and get antibiotics. Okay. If someone came to, I've never had anyone come and they have a diagnosis of gonorrhea and they won't go get antibiotics. I haven't had that problem, but I would definitely have to consider like that person, I would take them to the doctor if they refuse to go to the doctor. Same thing with chlamydia. I've worked also with chlamydia, and chlamydia is to the doctor, get antibiotics. And then you work with the herbs to help rebuild the flora, clear up any excoriation or inflammation, and get everything nice again and comfortable. And then there's this nasty little parasite. That's another little character. So these are common, fairly common. I have seen all of these in my practice. And this is sort of where they show up in the body. And you see the cervix, it's the doorway, right? It's like you stop here, hopefully. Chlamydia is very serious. It can damage the fallopian tubes, create infertility, as can gonorrhea. And then HPV is associated with cancer. So these are not something to take lightly. Okay. So you'll hear the word cervitis. So cervicitis is basically inflammation of the cervix. Wherever you hear the word itis, that means there's inflammation in that area. Primary causes are sexually transmitted infections, reactions to synthetic hormones. When I talk about synthetic hormones, basically I'm talking about birth control or hormone replacement therapy. So let's just be really clear. Those hormones are not like the hormones your body produces. I know that's kind of like the mainstream kind of like marketing tool that they use. They say, oh, these hormones are like the hormones your, no, these hormones are made in laboratories, and they are not like the hormones your body makes. So let's just get really clear about that. Okay, so I just call them synthetic hormones. Synthetic hormones. And then skin irritation. So, if you have had some really, crazy sex, or if there's been a sexual assault, That can cause irritation to vaginal lining and the cervix, and needs to be tended to. Abortions, DNCs, pap smears, all that can cause inflammation in the cervix. So those can all, you can support all that with herbal medicine. So here so cervical dysplasia is generally HVP, the human papillomavirus. I guess I got my V and my P mixed up there. And it's primarily in the transitional zone, so where those cells are changing. And this is what it looks like on a hand. So that's why people can sometimes feel those little bumps in the vagina or near the cervix. It's warts, basically. Is there a question? No question? Okay. Okay. So basically your risk factor is you have a partner that has an STI. Oops. Katie, I love the sound of your little kid's voice in the pussycat, but
I'm sorry.
it's okay.
So I have my video turned off, sorry.
Such a great little voice. Okay. Such a great little voice. So anyways, this is just, again, like the lens, of medicine. So, if you think your partner might have an STI, or you've had some bad experiences with STIs and you want your partner to go get checked before you make a commitment to an intimate relationship with him, there's no testing for men for STIs, for, in particular, HPV. There's lots for women, but nothing for men. So I kind of like, one more time, they let us down. Anyway, so here's other risk factors: taking synthetic birth control for over a 10-year period. Vitamin deficiencies, folic acid and vitamin A. So eat your vegetables and then eat more vegetables and then have more vegetables, lots of vegetables. As smoking, you see it all the time as a risk factor, but it's actually 20 cigarettes a day. How someone could smoke 20 cigarettes a day, I don't know. How someone could afford to smoke 20 cigarettes a day, I don't know, but smoking. And then there's like this whole thing about multiple sex partners and vaginal sex during puberty. And I'm like, oh, that feels so judgy, like it makes me feel uncomfortable as a woman, as an evaluating of a woman's sex life. So I'm thinking, like, why is that a risk factor? Well, maybe because young men are promiscuous, or maybe it has something to do with how the cervix is developing, and that it's in this really sensitive place during puberty, and it's more vulnerable. Or is is there enough maturity in the individual to really understand what entering into a sexual relationship is about? Or are we bereft of really good sex education and understanding how our bodies work? So I just question this and think, is there a better way we can approach this, so that if a teenager is having multiple partners, say, oh, it's kind of your fault that you got this because you enjoyed sex, or you were trying to figure out sex, or you wanted to be popular with the boys, whatever it is, I just think there's better language that needs to be figured out, and a better understanding why this is a risk, why that's a risk factor, why those two factors are a risk factor. Okay, Any questions, comments, concerns? No. Sorry for
I
all
think
my.
that the biome maybe is more the issue than necessarily the partners or the timing. Like if there is extra sensitivity as you're developing, then maybe they need to focus more on the biome and less on, like supporting that.
Yeah, and the thing is too, right? Like from like the a lot of the young women I work, like the teenagers I work with now, like they're in a totally different place of awareness of body and their cycle and that than I certainly was when I was at their age. And so sometimes I know for us, like, it was the bleached tampon, like that was our go-to. Well, talk about messing with the biome, but a bleached tampon, you know what I mean? So, like, I think we really have to think
Yeah.
about like all the different ways, or latex condoms, with spermicide in it. Like all these things we have to think about, like how are they actually affecting our vaginal health? In the 20s, it was often women were told to deuce with Lysol.
Wow.
Yeah, for birth control. And also so that they didn't have an unusual odor when their husbands came home. And I'm thinking, unusual odor? Like, what was their husbands, passing on to them if they had a bad odor, right? Anyways, yeah, so we have to watch those lenses. And it's something that I am really trying to work on and you know equalize things. Okay, so there's and the thing I love about plants so much, like I love a lot about plants, but one of the things I love about plants is plants love women. Like they love women's bodies. Like they will work so hard for a woman's body. They love supporting female health, and in a good way without causing you know all sorts of problems. and and it's amazing, like herbs can clear up cervical dysplasia. So okay, so I work very holistically, which by holistically I don't mean that I use herbs. I mean I try to take in the big picture, because the cervix clearly is part of the woman, and the woman is more than her cervix. So when we're putting together a herbal protocol for cervical dysplasia, we got to think about the woman and not just her cervix. So the first thing I want to know is about her overall health. And I can use herbs to support her overall health and well-being, because ultimately it is her body that is going to take care of the cervical dysplasia. I want to know, like, why is the immune system failing? Why is the inflammatory response not clearing up these cells? I need to know that, like, what's going on there. I need to know about the health of the cervical mucosa. So that's also, we're talking about, like, yeah, what's the health of the cervical mucosa? And then I also want to know about the microbiome health. So some of the questions I would need to ask the woman would be, how's your sleep? One of the things, you're told you have a precancerous condition that, we're going to watch it for 6 months, come back. Whoa, that is like serious stress coming down on someone, and that disturbs sleep. And sleep is when we heal. You know, one used to say, oh, digestion is all about health, what you absorb, what you eat. Well, I'm at the place where I'm thinking, no sleep, no health, no appetite, no energy to cook good food, no, like, sleep is everything. And sleep is basically when inflammatory processes are resolved. So if she's not sleeping, that's the first thing that has to happen before there'll be any health. So first, sleep. And there's lots you can do with herbs for sleep. And there's a lot of different, like, and it's not just herbs that you can use for sleep. There's lots of ways. What's your digestion? What are you eating? Are you getting your vitamins? Lots of vitamins, lots of vegetables, and lots of protein. The immune system runs on protein and fat. Hormones love fat. So again, like, what are you eating and how is your digestion? Are you digesting it? And are you having a bowel movement every day? Because if there's constipation and the stool sitting in the bowel, well, we looked at that picture and you can see there's a clear, not a lot of space between what's going on in the vagina and the cervix. Where is that picture? And the bowel. So if there's constipation, and there's research saying that if the stool sits too long in the bowel, the body starts reabsorbing hormones like bits and pieces of estrogen, and constipation alone can support creating uh, um, a hormonal imbalance. So what's going on there? Like, are things moving? Or are they moving too much? Or is there inflammation in the bowel? Yeah. Okay. So about the mood, check out the mood, always know what the mood is of the person. There's lots you can do for herbs for mood, or support people in just hearing, what's happening with them. There has to be a kind of and and I'm not about people being happy all the time. I think that's just ridiculous. Who's happy all the time? But there a kind of fluidity of emotions. So if you see something sad, you feel sad, and then if you see something that's joyous, you can have joy about. Or if you have some creative energy, you're being creative. Or someone's trampled your boundaries, you're angry. But there's no particular emotion or mood that just lingers for days. There should be a flow. So I'm looking always for flow with that. History of infections, this is really important. What is the history of infections? And this also leads into history of antibiotic use, history of steroid use as well. They both have a profound effect on the microbiome. Most pharmaceuticals have a profound effect. So I want to know what pharmaceuticals people have been on, including birth control. And then again, what's going on with your intimate relationships. So, okay, so now I'm going to be a bit like technical herbal language. If you do not understand technical herbal language I'm using, say Abra, I don't know what that word means, okay? Because in herbal medicine, there's a lot of language, and it's it it's useful language for herbalists to talk, because then we understand what we're saying to each other. So if you don't understand what I'm saying, just tell me, and I can tell you what the word means, okay? Okay. So the first thing we want to do is we want to look at her overall health and well-being, right? We want to make sure she's sleeping well, that she's, she's not like, in a really reactive state, or in such a drained state that she can't get out of bed. And we want to support her immune system, because the immune system is what's going to essentially take care of the cervical dysplasia. So we're going to use plants called adaptogens. And adaptogens, different herbalists have different ideas about what an adaptogenic, we say an adaptogenic plant, but an adaptogen basically helps us adapt to stress. And that definition is, to a certain extent, is problematic, because stress helps us adapt to our life, right? Like cortisol gets us out of bed in the morning so that we can respond to all the different types of challenges we have every day. That's the role of cortisol, for us to respond to stress. And then melatonin, which is cortisol's partner, is what puts us to sleep. And melatonin is the great healer. It's the one that helps resolve inflammation. So they cycle, and they cycle back and forth, and it's like your day-night cycle. That's the cortisol melatonin cycle. In traditional Chinese medicine, they talk about the yang and the yin, and the yang would be the day cycle, and the yin is the night cycle. So the yang is the cortisol, and the yin is the melatonin. And you want that cycle to be even. So the light comes in the morning, wakes you up, you wake up, you might be groggy for a couple of, well, me, I've been in like this crazy accidental coffee withdrawal for the last 3 days. So I've been like, oh my God, I didn't realize I like so much. Yeah. Anyways, long story, but definitely the wrong kind of coffee in my house at this moment. Anyway, so I love a good cup of one cup of coffee. So anyways, but that's like wakes up my cortisol levels, right? Or right now, right? I'm kind of have like a cortisol thing going on. So I have to do something at the end of this to prepare myself to sleep. Otherwise, I'm wrapped myself up and I have to sleep. So I'm out of cycling right now. I'm out of my regular cycle. So adaptogens help bring that cycle back into balance. That's basically what adaptogens do. And because they do that, there's all sorts of things that happen. The immune system runs better, blood sugars run better. Our nervous system, we tend to have better moods. We tend to have a better appetite because that basic hormonal cycle of day, night is running better. And that's what adaptogens do. There's all sorts of different types of adaptogens. You can go to the health food store and find adaptogen formulas. I call that kind of like shotgun herbal medicine nicer word would be kitchen sink herbal medicine. It's like someone throws a whole pile of adaptogens together in a bottle and here's an adaptogen. Whereas a herbalist would choose the best adaptogen that she has available for you. So right now, my all-time hands down favorite adaptogen is wild sarsaparilla, which is our native in this area. So I'm in the northeastern woodland forest, is our native ginseng. And it is a beautiful adaptogen, very calming, very soothing, not at all stimulating. Really lovely adaptogen. So I might choose that one. Then to support the adaptogens work is I would pick a nervine, and a nervine helps calm down the nervous system or soothe the nervous system. So one of my favorites is milky oat seed, and milky oat seed is super easy plant to grow, easy to have it in your garden, make fresh plant medicine tincture. Again, something you can have access to. And then here, maybe an immune tonic like cordyceps. I love cordyceps too. It's my favorite mushroom. So this would be a very nourishing, calming, relaxing, help support sleep, set her up through the day so there's more flow and less reactivity, and bring the immune system back into force to take care of this inflammation. And this would be a tonic. And I would probably put this person on a tonic like this for about 6 months. And I wouldn't necessarily dose high. She maybe has 1 teaspoon a day or something like that. And then I might do a tea. So because there is a mucosa challenge here, I would use plants called demulcents, and demulcents help repair the mucous membranes of the body. And marshmallow root would be sort of your classic middle of the road demulcent. And the thing I find with the mucosa is it doesn't really matter which mucosa I'm working on, they all respond. Like there's some kind of intelligence where they're communicating with each other. Maybe it's the cells that release the mucus. I don't know. No one does. So I would do a little plant to support the mucosa, maybe a nice carminative to support easeful digestion, because with stress, digestion usually gets a bit challenged. So lemon balm is a beautiful, gentle, calming, soothing herb that supports easeful digestion. And it also has some antiviral properties. So we're looking at HVP. So I'm looking at antiviral plants. If I really want lemon balm as an antiviral, I would probably use a fresh plant tincture of lemon balm as a carminative in a tea. It's not going to be as strong, but it's there. The inflammatory moderator is nettles. Nettles is often thought of like a cleansing herb or a deeply nourishing herb, but it moderates histamine response. So over a few months of drinking nettle tea, inflammatory responses really quiet down and move to resolution. And then a lymphatic, because we're talking about an infection in the groin. And the groin is full of lymph tissue, and the lymph is very much about delivering components of the immune system as well as cleaning up the results of infection. So a lymphatic, totally. Another lymphatic I might use here is poke root if I wanted to be really aggressive, and I would definitely be using that in a tincture. And then flavonoids. And flavonoids are, I put flavonoids in everything. They're a herbal constituent, and they help clean up the results of a battle between the biome and the immune system. Flavonoids are complex, beautiful, amazing. They're very cooling as well. And then I would do an internal remedy. And I shouldn't really tell you what I call these remedies, but they're, we could call it a liniment, but because I use infused oils alongside tinctures, and I put them in one bottle. So they need to be shaken before using, and then I just have people apply it to the cervix before bed. And this is to act directly on the cervix to balance the microbiome, to bring in some antiviral activity, and to help resolve any inflammation that's present. I've also used this formula or a very similar formula, similar kind of protocol for women with cervical cancer who are basically post treatment as well as during treatment. I might, yeah, I've used this while people are in radiation chemo. St. John's wort, though, you would never use if someone was having radiation, because St. John's wort would increase the burn of the radiation. So it's completely contraindicated if someone's having radiation. That wouldn't be, but the rest of the plant I would use. So Goldenseal is a super interesting plant. It's a plant that's high in berberine. And berberine, a lot of times you'll hear like Goldenseal is an anti-bacterial plant, but it's not really. What it actually does is it actually helps balance the microbiome. So bacteria that is commensal generally doesn't react to Goldenseal. It's bacteria that's not commensal that really shouldn't be with us, or yeast that really shouldn't be with us that reacts more to berberine, that berberine gets in there and kills the stuff. And also you got to remember that these are whole plants. These aren't just a constituent. So I use a lot of Goldenseal. It's an endangered plant. I really shouldn't be using it, but I do love it for very specific things. And in this situation, I find it hands down a great plant. But I only have a very small amount, 10 mils in here. So I'm not like using a huge dose. Self Heal, Prunus vulgaris. I use a tincture of it. It's an antiviral plant. It's also a healing plant. It helps resolve inflammation. It's very good for excoriation of tissue. It grows all over my backyard. I can just go out in my backyard and harvest it and make a tincture every year. It's a really beautiful plant, extremely accessible. Calendula infused oil. Calendula infused oil is delivering a lot of flavonoids to the area. Flavonoids are really important for helping the body resolve inflammation. Plantain tincture, I use plantain for everything, basically. Oh, what should we do? How about some plantain? I use it for everything. So plantain has tannins in it. So tannins are really useful for binding up microbes that we don't want to make it easier for them to be passed out with mucus, or for macrophages. So these are white blood cells with big mouths. Get them. So it clumps up viruses of tannins in plantain. It also has some oh God, my brain is like, where is that coffee in the morning? I'll tell you, I'm just like, um, what is it I want? Allanton. It has allanton in it, so it helps tissue healing, very low level, so I don't have to worry. And it's also a demulcent, and demulcents are very soothing and supportive to the mucus of the body. And then the last one in here I have is St. John's wort. Ah, what can you say about St. John's wort? You know, I kind of like the Ukrainian attitude. A formula without St. John's wort is like bread without salt, you know? So you have to have St. John's wort in everything, unless of course there's radiation. Then you don't use St. John's wort. And it's uh it's very healing for bones, it's burns, it's antiviral. Yeah, it's a really interesting plant. Yeah, I'm curious about the alcohol. Okay, let's see. Yeah, I'm curious about the alcohol. No, that's why I have it in the oil. I have, okay, so Marielle, am I saying that right? Marielle?
It's miel,
Miel,
like honey.
miel. Come le miel. Oh, okay, miel. So miel, yeah, totally. That's a great question. Like, yeah, alcohol, like putting it inside your vagina where there's excoriated tissue, unhappy tissue, like, whoa, doesn't sound like something I'd like to do, right? That's why I'm using the infused oils to dilute down the alcohol. And if you look at the formula, it's mostly infused oil. It's 50% infused oils. So that might be a I use different types of oil. This could be um, olive oil, or it could be, I really like sunflower oil and organic sunflower oil. We have an organic sunflower oil guy, grows organic sunflower oils and has his press right there. And it's fairly local. It's over by Carp, which is south of Ottawa. I like his oil a lot. I might use not apricot, avocado oil. So this will dilute this down, the alcohol. And I haven't had anyone complain about pain or stinging or anything with applying the alcohol oil mix. And I actually call it, it's like salad dressing. You got to shake it. You know, if you don't shake it, it doesn't mix. So I always just say it's like salad dressing. You got to shake it, right? Yeah, and so that will take care of. I know. Sue's a herbalist, so she's the salad dressing formula. Um, so yeah, so that would be a kind of sample formula I might put together. Now, depending on the person and what's going on, and like I definitely individualize things, but that would be my thinking of kind of like the broad protocol. Okay. And I might have her applying yogurt in the morning. rebalance that. Other plants, yeah, here's the yogurt. This is the yogurt I love. I don't know if they have this yogurt in BC. It's very local. It's a fabulous yogurt. So it's just fabulous. These are other herbs I might use in the topical formula. So thyme is an amazing plant. It's a plant that we don't really recognize that well, but if there's a microbiome imbalance, thyme can clean up most of them. And it's a systemic plant. So like we could put a little thyme in the woman's tea and she could drink it and it would have a systemic effect, or I could put it in a tincture that she's taking it internally and it would have a systemic effect. And I often think that viruses send out little communication webs throughout the body and they create these webs. I often think that. And so using these plants systemically will help really kill off the viral load that the person's carrying. Old man's beard, not one that I use a lot. Aviva Ram, who is a midwife herbalist, she recommends old man's beard. I use that mostly in really deep respiratory tract infections. I don't think I've ever really thought about using it in this situation. Myrrh, I find myrrh is another really powerful antimicrobial. I have a few issues with myrrh. One is comes from the Middle East, and some of those that area is in a lot of conflict. There's a lot of, so I don't know about taking medicine away from those people. That's their medicine. They need their medicine. And also it's a really powerful, and it can be, yeah, using it internally is intense, and putting it inside the vagina, I don't know if that would be too aggressive, quite honestly. I don't know if I'd use myrrh. Maybe in a salve. I don't know. But it's another one that Avina Ram suggests. Thuja, if there is cancer cells, I use thuja. Cedar is thuja. Cedar is a cytotoxic plant. So cytotoxic means it kills cells. And I've used thuja on skin cancers, cervical dysplasia, basal cell carcinomas, all sorts of things. And it really takes care of it all. Garlic, again, a classic, and sweet Annie, which is sort of a systemic antimicrobial as well. So these are plants if you don't have that. And like you can get yourself some nice organic thyme plants, grow them, make yourself a fresh plant tincture. Boom, there it is. You've got it in your medicine cabinet. Or you can go out I have some cedar in my backyard, I can cut them and make a tincture. Black walnut is also a really beautiful antimicrobial, antiviral plant. Lots of black walnut in this area. You can, ask anyone who has a walnut tree, go get their walnuts it's usually, I think it's like August that the walnuts are falling, and you can just go pick them up off the ground. There's so many. So easy to get your own herbal medicine going. Okay, so that's pretty much it for the herbs. Questions, comments, concerns?
What do you use of the black walnut? Do you use the whole thing?
I use the green husks.
Oh, you tincture the green husks, and do you take the seed out?
I just go, well, there's not really a seed. When it's a green husk, it's like kind of like just this white.
Yeah.
So you just get this, like, get out your cleaver.
Yeah, just chop it up.
Chop it up. But you have to make sure you're not going to a wedding that weekend, or like you're not doing anything, because like your hands are going to be like black with the iodine for maybe a week. It's like a mess. It's like, yeah, I had to go to a wedding last time, and then I go to a wedding.
Oh no.
Yeah. Well, you're the weird herbalist, right? I get that. You're the
So
weird.
do you just pick them up off the ground and just tincture them off the ground? I do have a friend who has a black walnut tree, but she
Yeah.
asked me, I didn't know what to do. And she said, come get them. And I said,
Yeah.
I don't know how to
And-
do that.
yeah. You just go take your bag,
Okay. Go
pick
get them.
them up,
Okay.
chop them up. I can't remember. Email me and I'll tell you what ratios I did.
Okay. Yeah. Okay. Thanks.
Yeah.
That's cool.
Yeah. It's super. And then you'll have it forever and like learn 25,000 ways to use black walnut tincture.
Right. Yeah. I know it's an antiparasitic, right?
It's antiparasitic. It's astringent. It's, yeah. I use it for repairing the mucosa in the gut, right? When there's leaky gut. Yeah, I use a lot of well, because I have so much of it. It's
Right.
free, and I just go out and get it, and it's
Get
there.
it.
It's there. So yeah, 100 low thyroid, always black walnut. Okay, I don't think I'd put kimchi in my because it's all got all that spicy, like just the yogurt. It's very soothing. You want to think soothing. That's the word you want to use. Soothing. You want to soothe, right? Like this is a sensitive, tender part of our body. So that's why I'm going, I don't know, myrrh so strong, Soothing. You want to think of the word soothing. Your medicine is soothing when we're talking about the cervix. It's sensitive. Sensitive people need to be soothed. Sensitive
How do
part.
you apply it? Do you just apply it with your fingertips or how
You
do you
just
get it up there?
all bacteria, right? Boom, 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 boom. It grows. Boom, 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 boom. Like if people are shy of their vagina, some people are, you just put it on the labia around where the opening to the vagina, or you can just put some on your finger and put it in.
Put it in there.
Yeah, you don't need a lot. It's not a huge, massive area. It's not like, your small intestine or your colon. It's just a little tube, you just put a little bit in and bacteria grows and it likes that environment. It's a happy environment for lactobacillica. But yeah, I don't think I'd use kimchi. I would use definitely yogurt or kefir if you can get a good kefir. Okay, so if you want to know more about your reproductive health and your, particularly when it comes to using plants to release pregnancies, essentially check out the vessel and you'll see why I'm so like, oh, we got to look at the lens that we're looking at female health from because I'm like, oh, yeah. So
Great book. I love that book.
oh, thanks. Yeah. I've got another one I've almost finished.
I'm excited.
Called The Grandmothers.
Nice.
Yeah. So questions, comments, concerns, complaints?
So did I hear you say that plantain had allantoin in it? I just want to clarify.
Yeah.
It does. So would you not worry that doesn't allantoin?
Not like comfrey.
Okay, but it's not a proliferant. Like it wouldn't increase the hyper.
Not like comfrey.
Not like comfrey. Okay.
Or calendula also has the allantoin in it.
Oh, okay. I didn't
Yeah.
know that either.
Yeah.
Okay.
So you just want it like there's very low, like kind of like that's why I got comfreys. Another plant you could use would be yarrow. See, now Sue's a herbalist. So now we're doing this herbal. This is what like herbalists start talking like, oh yeah, you could try yarrow too, Yarrow's a great plant, great tissue healer. So there's lots of ways you can tend to your cervix. And the most important is if you have an uncomfortable diagnosis given to you and you're told you just have to wait, that there's nothing you can do, know that there's things you can do to support your health. And one of them, even if it is to have really good sleep at night, or to make sure your bowels are moving every day in a good way, or increase your vitamins, your vegetables and protein, or even taking vitamin C, deciding I'm going to take some vitamin C, There's lots you can do for your health. You don't have to wait for someone else to do it for you. And plants love our bodies. Even if you found yourself a calendula infused oil or a calendula salve and use that and put a little bit on your cervix, it would be better than nothing, and it will help with the healing. It doesn't have to be a whole big protocol. Just keep it simple and tend to yourself. And yeah, and like if you're if you have HBP and you've had the same partner for a long time, send him off. Like they can't test it, but they must be able to give him some kind of antiviral, or send him to the herbalist to get antivirals, you know?
Totally.
Yeah.
Don't
Like,
forget the man.
yeah, like they
They were usually part of the problem.
yeah, they haven't either. Yeah. So what do you get? You get cervical dysplasia, and then you keep having sex with the guy who keeps giving you more and more of this virus. Like, what the hell? And he's not even tested or treated. Like, what the hell? Like, sorry, I shouldn't swear. I haven't really started swearing yet.
Yeah.
Okay. Okay. So any other questions, concerns? No.
You had said that St. John's wort would, if there's radiation, would cause more inflammation, I think is what you said.
Burning.
Burning. Why is that?
Well, that's basically what they're doing with radiation. They're burning something off, right?
Yeah.
And so St. John's wort has this, like, if you read about St. John's wort, you'll see it's photosensitive. So that basically means it's sensitive to radiation of the sun. And you get, like, it enhances your sunburn, or so if you're having radiation therapy, like say someone's getting radiation therapy on a tumor on the breast, and you put St. John's, because it also is very good at healing burns. And you decide, okay, I'm going to put the St. John's wort to heal the burn from the radiation. And then the next time, like, that tissue is going to be super sensitive to the radiation. Just don't use it.
If you were taking it orally, would it have the same
I
effect?
wouldn't do it orally.
Interesting.
If I was getting radiation therapy, and I, like, out of, like, I'm not a completely black and white person when it comes to the industrial medical complex. Like, it does have its function, it does have its place, but I would never do radiation personally.
Right.
And I know lots of people who do, and I've supported a lot of people through radiation, but I would never give anyone internally St. John's wort. No.
Oh.
Not like, and the thing with herbal medicine, it's always dose. You can dose, like, it may be a really low dose. St. John's wort wouldn't have that effect. I don't know how much you'd have to take of St. John's wort to enhance the effects of the radiation, but I don't want to know.
Right.
I don't want to make that. I don't want to, because it's such a difficult time in someone's life. I don't want to make it worse, right? And there's
the risk.
Yeah, the risk just isn't worth it. So, and there's so many different plants you can use that you just pick a better plant,
Interesting. My mom, in 2021 was diagnosed with colorectal cancer, and she was like stage 3.5. It told her that she didn't really have much hope, and she's good now. It's great. She used tricky till and a bunch of other things they told her not to. And it seemed to really help. They were like, we have no idea medically how you shrunk this much, but we're able to remove it now. And it was a whole thing. But she was also taking some St. John's wort, and she was very much uncomfortable during her radiation and stuff. So that's that's good. Really good to know.
Yeah, it's just not really, like, there's so many herbs you can choose, like, depending on what the person's struggling with, there's a lot of different really beautiful plants. One of my favorite plants for the nervous system right now is a plant called wood betony that grows so easily in my garden, and it is amazing. And it's mint family, so you won't have the same kind of challenges that in that particular, like, I use a lot of St. John's wort. I use gallons of it, but in that situation, I just no.
That's really good to know. Thank you.
Yeah, mushrooms. A lot of
I just
mushrooms.
have one more question. Sorry. Do you think that the uterus would absorb something that you apply to the cervix? Like, does it go
Oh,
up?
yeah.
Oh, it does. Okay. It sucks it
I
up
would
there.
guess so. Yeah, I would guess because it's yeah, yeah.
Okay.
Because, like, you know, you put a tincture, like, you know, when you're doing, and you have you ever
Yeah.
done an experiment where you feel the pulse and the tincture on your arm?
No.
No, you've never done that? Oh yeah, but totally. That whole area would be like, and that's the thing. There is no such thing as localized medicine.
Mm.
In my
So
mind.
it'd be worth thinking about for other disorders of the uterus then as well. Like,
Yeah, so what they use a lot is well, I've used them, but it's kind of a disaster. Uh pessaries, they call them pessaries, you know, like
yeah.
suppositories, and it's a pessary for
Yeah.
yeah, and you know, you put it up its close for fibroids if you've done made pessaries for fibroids. But I find the pessaries are really
Well, they're
personal.
coconut oil or something, right? And the oil I think is problematic because it's
Well,
oil.
yeah, the oil isn't so it's yeah, and then you know, so you put it in at night, you have to wear something so that you know it doesn't get messy and then sort of sits there in the tissues and it's absorbed. But I find I'm a terrible pessary maker. Like they I can't get them all the same shape. I can't get so this is just super easy. Do the salad dressing a little bit. Yeah. I've had yeah. Yeah, I've definitely used topical. And the other thing too is you can put like I would also be probably doing castor oil packs on the pelvis with some ginger essential oil in the castor oil pack. I would probably be doing that with the person too, depending on who she is and like, you know, if she's got 3 kids running around and you know, she's trying to work and she's got all this health stress going on, like I'm not going to give her a lot to do because it's too much. If it's someone who's like, I'm taking 6 months off to really get myself, you know, I really want, you know, and I'm going to give her lots to do. You know what I mean? Like it kind of, you kind of have to decide because you don't want to add stress to someone's life.
Yeah.
And you don't want to set them up so they fail either. So yeah, you kind of have to know who you're talking to. Does that help?
Yeah, so interesting. So enlightening.
I know I throw a lot at people when I
Good.
this short little and it might you might just feel overwhelmed. And you know, if you feel overwhelmed, I apologize. But the thing is, if you can walk away with just the idea that you can do something for yourself in a situation where you're told, oh, you just have to wait and see, that's what I really want you to walk away with. That you have you have the ability to tend to your health in a good way.
That's right.
That's what I want you to walk away with. That
That's
you're not
great.
powerless.
Yeah, this has been very empowering and informative.
Yes, good. Power. Excellent. Okay.
Thank you.
Now we gotta go work on our cortisol levels and our melatonin levels. So have a bath, a little lavender, you know, nice cup of chamomile tea or something. Okay, bye.
Thank
Definitely great. Thank you. Thank you.
Thank you so much.